Hi, this is Josephine Powell from Section 2. I'm here to do my IV medication piggyback administration. So the first thing that I'm going to do is I'm going to check my doctor's orders, and I see here that my patient already has saline running at 100 milliliters an hour, so this is going to be an IV piggyback for this antibiotic that he's ordered. He's ordered vancomycin 500 milligrams and 100 milliliters of sodium chloride every 6 hours. So then I'm going to check that against my MAR. And I see here that my patient does have the IV fluids ordered, and then he also has the vancomycin 500 milligrams IV and 100 milliliters of sodium chloride every 6 hours, so that matches good. So then I'm going to look up the medication to make sure that I know all the information about the medication that I can know to keep my patient safe. So I'm going to look up the action, the purpose, the recommended dose, side effects, contraindications, nursing implications, and then infusion time and rate. So see here that vancomycin should run over at least 60 minutes to prevent a condition called the red man syndrome. My nursing implications is I'm going to check my patient's labs. I'm going to make sure that I look at his BUN and his creatinine, because vancomycin can be rough on your kidneys. I also am going to check for peaks and troughs, which is an important lab to draw to make sure that the vancomycin is working and that they're not going into toxicity. Let's see, this recommended dose is 500 milligrams every 6 hours, so it's a good dose for my patient. Alright, so I am going to take my MAR, and I'm going to get my medication, and I see here that in this bottle, vancomycin 1 gram per milliliter, so he's going to get 0.5 milliliters of the vancomycin out of this bottle mixed into the mini bag, 100 milliliters of normal saline. So first thing I'm going to do is I'm going to do my hand hygiene. And I am going to put my gloves on. And then I am going to get my syringe and my needle. I'm going to clean off the top of my bottle. Okay. And then I'm going to get my syringe. I'm going to attach my needleless device here. I'm going to drop half a milliliter. Insert air into my bottle of vancomycin. I'm going to draw back half a milliliter. So there's my half milliliter of vancomycin. I'm going to recap my needleless device. I'm going to take my mini bag, get another alcohol wipe, and I'm going to clean off the port. And now I'm going to push the vancomycin into the mini bag here. And this will go in the sharps once we're done. Gently aggregate my medication. So now I'm going to prime, or let me label my medication. With my patient name, the medication, the amount of the medication, the date, the time, and my initials. And I'm going to place that on the naked side of the bag. Now I'm going to hook my tubing to my medication bag. I'm going to pull this, making sure to keep it clean. Do this, and I'm going to spike my bag, making sure I don't touch anything. I'm going to make sure that my roller ball is clamped. I'm going to prime my chamber, and then I'm going to open my roller ball just enough to get enough fluid into here to prime my tubing when there's no air bubbles. Okay, so my tubing is now primed. So I'm going to take this into the patient's room. I'm going to get my hand hygiene bottle. This time I would remove my gloves. Oh, and let me label my tubing. Take that with me too. Okay? So I have some alcohol and I have my MAR. So at this point my gloves will be removed. And then I'm going to do my hand hygiene before walking back into my patient's room, and I'll put my gloves back on. Mr. Johnson, my name is Josie, and I'll be your nurse for today. Your doctor's ordered a medication called vancomycin to help fight against that infection that you have going on in your abdomen. I see that you've had it earlier in the day. I just want to make sure that you have had this. Do you remember this? Okay. All right. I'm going to check your name and your date of birth on this one. Can you tell me your first, last name, and your date of birth? Okay, great. All right. Now I'm going to hang my medication here. I'm going to label my tubing.
Still doing okay?
Okay. Now I'm going to stop his IV fluids here.
I'm going to go ahead and set the
I'm going to go ahead and I'm going to check his IV site. medication. Everything looks good. So I am going to clean off this hub here.
Okay, once we have that set,
That's below the roller ball.
I would leave that there. This is going to be infusing over 30 minutes. I'm going to check the patient.
And I'm going to hook my medication into this cord.
Doing okay, Mr. Jones?
This would have had a
Please
cap
call me
on
if
it.
you have
I
any
was taking
problems
the
with
cap off.
nausea or vomiting
Okay,
or
before I
dizziness and
set
headache.
the drip rate,
If you have any
I'm
problems
going
at all,
to take my
your bed
hanger.
is up, your rails are
I'm
up,
going
you
to
have
lower
clear the
my IV
bathroom.
fluids.
No pain. Patient's personal belongings are there. The call light slide in.
And I've already
You
figured
guys,
my
everything? Just
drip
call me
rate
if you need anything.
to
and I'll be back
17
in 30
drips per
minutes to
minute.
check. So I would take my blood pressure in my hand.
Here's my
I'm going to go back
calculations.
and document that
Okay.
date and time.
So I'm going to sit
insertion,
here for a full
just
minute,
IV, Zosyn.
and I'm going to count my drip rate to make sure that it's 17 drips per minute.
Use at 17 drops a minute, and that is going to be over 30 minutes.
Okay. So it's set at 17 drips per minute. Mr. Johnson, this medication is going to run for about an hour. Okay, if you notice any feeling any different, you notice any redness or pain at your IV site, please let me know, and I'll be back in an hour to disconnect your IV medication. Okay? All right, thank you, sir. So at that point, I would take my gloves off, do my hand hygiene, and I would leave the room. After about an hour, I would go back in the patient's room. So, hi, Mr. Johnson, I'm back. It looks like the medication is all done. How do you feel? Do you feel okay? You feel like you tolerated it okay? All right, that's great. So at this point, what I would do is I would clamp this off.
Hang out for sterility.
I would unhook. I would recap it with the cap, and I would hang it up here for the next nurse to use while it's still within its window of being.
I'm going to go ahead and clean.
And then what I would do is I would lift my IV fluids off the hanger here.
Flush again. Again, check.
And then this was going at 100 milliliters an hour. So I would reset it to the correct per minute.
Flush the line, and I'm going to clamp it up again. I'm holding.
Okay, so it's going at the correct rate. All right, Mr. Johnson, I'm all done for right now. Now, if you need anything before I come back to check on you, you call and let me know, okay?
Okay,
All right.
everything looks good.
And then I would take my gloves off, do my hand hygiene, clean up my area,
Mr. Jones.
and I would be complete with that skill. And then my documentation that I would document for this skill
Once again,
would be, I would document the medication on the MAR. I would also document what I mix the medication into. I would document the I's and O's in his chart, and then how the patient tolerated the drug, and also his IV and his IV site, how the condition looked before and after the drug administration. All right, that's it. Thank you.